Now, in the second section of our lecture, we will talk about some diagnostic steps or tests used for the diagnosis of Chagas disease. In this, we will also talk about the clinical course of the Chagas disease. What are the diagnostic tests for the Chagas disease and also diagnostic tests for the chronic Chagas disease. So far, we know now that acute Chagas disease is a mild form of illness. There is just mild febrile illness present in the acute phase. Lot of people, they are not even aware that they have the infection. But as the disease progresses, there is chronic Chagas disease, and that is a serious disease. It causes deaths more than any other infectious disease and cause involvement of the heart, cardiomyopathy, which is most common organ affected. Then it also causes meningoencephalitis, and then mega disease, which include mega esophagus and mega colon. So all these are the effects of the chronic Chagas disease. So, and then there is also subpatent parasitemia that occurs in this phase, and there is spread of the parasites through the lymphatics and through the bloodstream to different organs of the body. So very, very important is the diagnosis of the chronic Chagas disease that we will discuss in this section also. So clinical course of the Chagas disease, there is a break in the skin. So at the site of the bite, there is a break in the skin that's present, and then organism enter through that break in the skin. An indurated area of erythema and swelling, and this is known as the chagoma. Oma is the term used for the tumor or the swelling or the mass. So the tumor form as a result of Chagas disease is known as chagoma. So there is a break in the skin. Through the skin, there is infiltration or entrance of the organism, and then this leads to an indurated area of erythema and swelling, and this is known as the chagoma. Local lymphadenopathy, there is hyperplasia of the lymph nodes, there is interstitial edema, and this leads to local lymphadenopathy or the enlargement of the lymph nodes. Romana sign when the conjunctiva is portal of entry, when the organism enter through the conjunctiva or mucosal layer of conjunctiva, there is Romana sign, which is the swelling around the eyes present because the eyes are involved during the or conjunctiva is the portal of entry. There is malaise, fever, anorexia, loss of appetite, and there is edema of the lower of face and lower extremities. Generalized lymphadenopathy, hepatosplenomegaly, and severe myocarditis, meningoencephalitis occasionally. All these features can occur, and there is fever, malaise, anorexia, edema, cardiomyopathy or myocarditis, lymphadenopathies, hepatosplenomegaly. So all these features can occur when the conjunctiva is the portal of entry, because then it's in the very close proximity to the brain and to the other organs. Now, the clinical features, other than those, we have first sign develops at least 1 week after invasion. The incubation period is 5 to 10 days, so that's about the time when first symptom appears. Usually within 4 to 8 weeks, acute signs and symptoms resolve. And if you remember the diagram, there is patent parasitemia that reaches the top at about 10 days and then slowly decline by about 8 weeks. So that's the time period during which the acute phase lasts. Symptomatic chronic disease become apparent years after initial infection. There is about 5 to 40 years period for the chronic Chagas disease, and during this period, we have symptomatic chronic Chagas disease develop. Clinical course of the infection, there is rhythm disturbance because of the involvement of the heart. The heart rhythm is affected. Segmental or dilated cardiomyopathy. Cardiomyopathy is enlargement of the heart muscle. Cardiomyopathy is disease of the heart muscle. Cardiomyopathy occurs and it may be segmental or dilated. Some segments can be involved, or it can cause the overall dilatation of the heart due to the involvement of the muscles of the heart. So myocardio is for the heart, myo is for the muscle, pathy is disease. So disease or involvement of the heart muscle. Thromboembolism. Thromboembolism can occur as the embolism from the thrombus, which is a blood clot, and sometimes a piece can dislodge from the clot and cause the embolus and cause the blockage. So thromboembolism. Right bundle branch block. Premature ventricular contractions. Ventricles are badly affected. We already mentioned that there is biventricular enlargement, thinning of the ventricular walls. So all these changes can cause premature ventricular contraction. Tachy and bradyarrhythmias. Tachy means fast, brady is slow. Arrhythmias can be tachy, fast arrhythmias, and the slow arrhythmias. Cardiomyopathy. Biventricular heart failure due to biventricular enlargement. There is poor pumping of the heart, and this can cause heart failure. Embolization of mural thrombi to brain or other areas. I already mentioned there are thrombi, blood clots, and from these thrombi sometimes small pieces dislodge and they form emboli, and this embolization can go to the brain and to the other tissues and cause damage, cause ischemia of the brain and the other organs. Sudden death can occur due to stroke and congestive heart failure. Stroke can be due to meningoencephalitis due to the embolization of the cerebral vessels that can cause stroke. So congestive heart failure and stroke can lead to death. Megaesophagus leads to dysphagia, difficulty in swallowing, odynophagia, pain on swallowing, chest pain, and regurgitation. Aspiration due to severe esophageal dysfunction. repeated episodes of aspiration pneumonitis, weight loss, cachexia, pulmonary infection. Now the diagnosis, how we can do the diagnosis, detection of parasites. Here you can see the parasites in the blood. So detection of parasite, microscopic examination on anticoagulated blood, buffy coat, FIMSA stain, thin and thick blood smears, and microhematocrit tube containing acridine. So all these are different specimens that can be used for the detection of parasites. For chronic Chagas disease diagnosis, detection of IgG antibodies that bind to Trypanosoma cruzi antigens. Confirmatory testing is at least 2 assays, well-characterized positive and negative comparison samples. Radioimmune precipitation assay, highly sensitive and specific methods of confirmation. Then we have PRISM Chagas assay, second test for the screening. So because blood transfusion can also lead to the spread of infection, so this is the test for the donor screening. That was all about section 2. Thank you for watching sqadia.com.